let me introduce you to the donor area. All this is our donor supply. All this composed by individual follicular units, one by one. Okay, let's start the procedure. We're gonna select individual follicular units. Of course, we're gonna respect some space in between the follicular units because we don't want to over-harvest the donor area. That's it. Seems we got a pretty big session, huh? First session is done. Patient is extremely happy. Now we are going to do the second procedure. Second procedure, we're gonna complete some empty space that we could find and still manage to don't over-harvest. We can carefully select areas and remaining residual follicular unit to don't break. We don't want to break the overall structure of the donor area. The residual donor hair is important to maintain the original architecture because we don't want to disrupt the architecture of the donor area. You don't want to be transparent. We don't want to over-harvest the donor area, which would be a big mistake. Are you ready to the third session? We still can collect some follicular units, but of course, the resource is getting limited. It's getting hard and hard to find a spot that we can remove one follicular unit without breaking the overall architecture of the donor area. Because FUE is about that. FUE is about removing the donor supply without breaking the overall architecture. Of course, you can keep removing and you can add SMP, but we're not talking about this now. We're talking about how can we remove without damaging the donor area. The question is, how much can you remove from the donor area? We can remove 30%, 40%, 55%. Of course, depend of the hair mass, depend of the caliber, the density. We have a lot of information how much you want to remain in the donor area. Depends on the coverage index. There is a smart index to look for. But my point is, doing FUE, we have to keep space in between. But imagine that we have done FUT here. If you have done FUT, all this area will be removed, all this, and we're gonna suture this and this. So all these spaces, this residual hair, will be harvested and will be planted in the recipient area. And then, after that, you still can do FUE. You still can harvest all the hair around because they are available, they are there. But imagine this happy patient. He's over 30s, but he has no idea what's going to happen. In the future, the donor may decrease, or even like this can decrease. Sometimes more. And sometimes he can have a retrograde alopecia. So he will miss this part too, because the retrograde androgenic alopecia will hide the lower edge. We end up with just this area that is safe. So the problem of harvesting all this hair in a young patient around the 30s, we can't be sure that what's going to happen when he's 50 or 60, because all this hair, all the follicular unit that we've moved will miniaturize and he will lose it. My approach for younger patients that unstable, that you're not sure what's going to happen to them, stay in the safest area. And for sure, the central part is the safest zone. So there's a second big advantage of FUT compared to FUE. FUT, a card that you still need in your pocket.